some people actually after yesterday's or day before yesterday's physics paper, or yesterday's, they are asking what is the purpose of physics for students who want to do medicine. You don't do any physics sums in medicine unless you want to become a consultant anesthetist or oncological surgeon. When you do oncology, you need to know radiation physics. When you do anesthesia, you need to know gas physics. Other than that, nobody else needs to know physics. Anyway, you will learn physics when you do the postgraduate. Do you know the reason for physics? Now, a person who is doing a sport, okay, let's say cricket even or football, okay, everybody knows football, I guess, right? A person who plays football, do you think they practice only football? Do they go to the gym? Do the football players go to the gym? Yes. Do they go to the bar and squat like this? Do they do bench press? Do they do, I don't know, different lunges and stuff like that? Do you see any football player when they're running behind the ball do this? Huh? No. Then why are they doing that in the gym? If they are not doing lunges in a football match, why are they doing lunges and squats in the gym? Huh? To train their muscle. The lunges and the squats and the push-ups and the bench press that they do in the gym will help them when they play football. So now, just like that, what is physics going to do for you if you go to do medicine? Physics, can you do physics by memorizing? No, how are you going to do physics? By understanding the content. Just by understanding the content, can you still do physics? No, you need to think. You need to think inside the box. You need to think outside the box. So in A-level biology, as long as you remember the content, you're fine. But in medicine, they give you multiple clinical features, no MCQ choices. You need to figure out what's wrong with the patient. Then you have lateral thinking, outside the box thinking. So if you are a person who is good at memorizing, then yes, you can go to medicine and suffer because you haven't developed the skill of lateral thinking. But if you do physics and chemistry well, what does that indicate? You are a person who is capable of thinking outside the box, who is capable of solving complex problems, who is capable of doing maybe mental math. So then that tells, okay, this person is probably a smart person. A smart person who is able to remember the content, will he or she be a better doctor or a person who can just remember the content? A person who is capable of thinking laterally and remembering the content will be a better doctor. That is why for medicine, dentistry, you need 3 A's, physics, chemistry and biology, even though you only require the human part in the future. So don't think whatever that you're learning in physics and everything is, waste. No, that helps you improve. Even if you take Alzheimer's, you learned Alzheimer's, cortical degeneration as you age. Very rarely when you get Alzheimer's, unless you have a genetic risk, you reduce the risk of getting Alzheimer's if you do puzzles. If you train your brain to do hard tasks. So if you're a doctor, you're probably doing hard work through your brain almost every day. No? The chance of you getting Alzheimer's will be late. So that is what physics does. Physics will improve your ability to think. If not, you will be parrots, easily replaced by AI. If I want somebody to just spit out what they remember, am I going to trust you or am I going to say, what are the causes for hypothyroidism? Who do you think will answer more accurately? This fellow will answer more accurately. Then what is your purpose? But if a patient comes sometimes in a different presentation, something that is not there maybe in most books, or something that is rarely seen, only a human might be able to detect that pattern. A smart human will be able to detect that pattern. That is why physics and chemistry is important.